RAO. So which way did the spine go?
Right.
Good, the spine is turning towards the right, which means which ribs are we interested in?
No.
The left ribs. Are we more interested in the left anterior or left posterior ribs? Left anterior. It's gonna.
PA projection.
That's right, PA projection. So it is the side that's closest to the IR, but it's the side closest to IR in terms of anterior versus posterior. It's not about left and right. It's about, is the anterior closer or the posterior closer? Anterior is closer, so this is more for the left anterior ribs. Left anterior and left side, right? Left axillary ribs. Good. All right. So as far as positioning, let's go ahead and start with our upper ribs. Okay. So easiest way to do this, right, when you start off, just start the patient off PA. Right, so you just get them nice and flat against the IR and find your centering just like normal. Right, so you're going to find your T7, right, go down your 7 inches. You're going to come over here, check the axilla, come over here, 1.5 to 2 inches of light above the shoulders. So this height is good, right? Once we get that, then we can think about turning the patient. Of course, I'll also make sure to fix the IR. And so now we will turn our patient into an RAO. Remember, how much do you turn your patient?
45 degrees.
45 degrees, just like your chest obliques. Okay, so hopefully by now you have a better idea of what a 45-degree oblique should look like. So, good. Point your toes towards me. Very good. All right. So that's our nice 45-degree oblique right there. Feet also at 45 to help the body stay 45, right? Don't want the feet pointing towards the windows too much. Don't want them pointing off towards the side too much. Nice and 45. Good. Okay. Arm positioning. Anyone still remember how to do arm positioning for an oblique? Right.
The star of the show will go up, so.
Star of the show goes up.
So this one.
Very good. So in this case, left side is what we're looking at, so left side goes up. Now, because we are PA, we do actually have something special we can do. That's right, instead of putting the left hand on the head, we can just rest it on the IR instead. Okay, right hand goes to beyond the hips. Good, nice and low, touch that shoulder. There we go. That's our hand positioning. Okay, so remember, PAs should look like this. Okay, hand either on the buttocks or hand on the head, either one is fine. Other hand should be back here on the hip, on the butt, right? And then we've got a nice 45-degree oblique. Centering. We got our vertical centering, but now we need to do horizontal centering. So where do we center? This is going to depend on if you are doing unilateral or bilateral. If I am doing bilateral, if I want to get the entire thorax, both left and right side, right, I am going to center, so I'm going to just slide it back slightly. Just slide your shoulders over. Right. MSP, MCP, right in between. So I'm going to have light on the left side, I'm going to have light on the right side. Okay, so this covers the entire thorax. I'm centering between MSP here and the MCP here on the side. Does that make sense? Mm-hmm. So this is bilateral because even though my side of interest is the left side, I am still capturing the right side on my image. I'm capturing the full side, both sides on my image. Does that make sense? Mm-hmm. That is bilateral. However, some places may ask you to do unilateral ribs. They're like, if we only want the left side, then only shoot the left side. And so the centering will be slightly different. In this case, if we are looking at only the left side, right, once again, we've got our MSP here, but instead of going MCP, we're going to go to the side of the patient. Right? And we're going to take this and center, it's more like that. So MSP, here's the side of the patient. And so we're going to be centered in between MSP and the patient side. Notice, what do I have on the right side now?
No light.
No light, I have shadow here. Right, so this is focused entirely on the left side, right? I do not have the right side on this picture anymore. Okay. So I can even collimate it just slightly. Right, so that's the difference between unilateral versus bilateral. Unilateral, only looking at one side of the ribs, and then bilateral, we're going to be looking at both sides of the ribs, right? Both left and right side. Make sense? Okay. Any questions about unilateral versus bilateral? No? Right. In that case, which side are we going to mark here?
All right.
The right side? Sorry, I moved it a bit too far.
We're looking at the left, so wouldn't it be the left?
Okay. Yeah, so which ribs are we?
The right is touching the IR.
All right, that's right. So right side is touching the IR. So even though I am interested in the left ribs, I'm going to go ahead and mark the side which is closest to the IR, which is my right side. Okay. So yes, I know, this is not the side of interest. This is the side of interest. But I'm just marking whichever side is closest to the IR, just like all my other obliques. All right, any questions? Okay, right now, because this is upper ribs, what are my breathing instructions?
Same thing as the chest.
Same thing as the chest. So what is that?
Take a deep breath in.
Deep breath in.
Let it all the way out.
Let it out.
Take another deep breath in.
Deep breath in.
Hold your breath.
Hold your breath.
X-ray.
X-ray.
And you can breathe.
And breathe. Very good. Okay, so once again, upper ribs, we do this on inspiration when they breathe in. For lower ribs, right? We basically do the same thing we did last time. Just take this, drop it down to about the level of the iliac crest, or just a tiny bit lower, and then do it on expiration when they breathe out.
Do that for anterior ribs, even obliques?
So yes, on obliques you do lowers, and the reason is because now we're not just looking at the front, but also the side, right? So that's why we do lower obliques. Okay, any questions about that? All right, you can relax, Monsi. Let's see. All right, so we covered